Okay, everyone, this is another memory, and remember how I told you crazy things always happen to me. So, this is one of the craziest. I was on my second year OB rotation, and OB and labor and delivery and the newborn nursery and all that were in the main part of the hospital, the North Tower at the time. Remember, this is 30 years ago. Remember, everything has changed, even structurally and architecturally. Because at that time, we went to classes for first year in the south part of the hospital, South Duke, or Duke, no, sorry, it was Duke South, I believe. It's a long time ago, guys. Well, there was also an area there for inpatient psych at the time, 30 years ago. Well, I was on my OB rotation, and my resident got a page to the psych unit, which made not a lot of sense. Now, let me tell you about my resident. She was very sweet and very timid, which is unusual because OBs are often known for, they have to have, quick decision-making skills because there are a lot of life and death situations they come upon and they have to just call it one way or the other. But let me explain something. At Duke, we had a lot of MD/PhDs. So you can imagine, just for speed, we would abbreviate that into MUDFUDs, MD, PhD. See where we got that? So it was a little bit like teasing them, but it was also just a quicker way to say it. And so she was a MUDFUD, an MD, PhD. Very brilliant, but with plans of becoming primarily a research physician, not a clinical physician. So she was entirely academic. The problem is, to get to that point in life, you still have to go through the motions and do some of the mandatory clinical things. And she certainly wanted to, it just wasn't her strength or her forte. So I didn't know anything. This was relatively new in the year. I was just tagging along for the ride. So she got this call. And we had lots going on in labor and delivery that night, checking this mom, checking this strip, delivering that baby, all sorts of things going on. And finally, and they said, the person who paged her had said it was not urgent, and which is great. So when we finally got around to it, it was probably 11 or 11:30 when we went over there. Let me tell you about this. At the time, I don't know if it's still this way, in the main tower, Duke North, to connect it to Duke South, there was basically an elevator, but instead of going up and down, it went side to side. So like a little tram, but in a unit, very much like an elevator, except sideways. And so we rode that over to evaluate this consult. And remember, this was before everything was electronic and digital and in the computer. And these days, you would have just pulled up her chart on the screen and read all the details. But we didn't have any of that. We just got a psych resident calling an OB resident to come evaluate, do a consult on his patient. So we rode over there, saw the lady. She was instantly, obviously, extremely pregnant. And even in the few minutes we were trying to take a history, how many weeks are you, any complications with your pregnancy, just the basics, we picked up on the fact that her abdominal pain was intermittent with complete relief in between episodes, but pretty significant pain during episodes. And the reason for the consult was abdominal pain in a pregnant patient. That was the actual reason that the resident had called for a consult. So pretty quickly, neither of us even being fantastic at what we were doing, we realized this lady was in labor. So she was sitting in a wheelchair. I don't even believe she had been admitted for very long on the psych unit. And we, at least my resident said, I'd really rather her be on a stretcher. Turns out that was a really good call. So we switched her over in between contractions to a stretcher, got her loaded up on the sideways elevator. She continued to moan about every 2 to 3 minutes. And then she would ease up with the pain. She wasn't very talkative. We didn't get a lot of details about her pregnancy history. It seemed that she had not had a lot of prenatal care, so we didn't have an exact gestational age, which we love to have in peds, This was before I knew anything about peds, because this is one of my very first clinical rotations. And we rode that sideways elevator over. Both the resident and myself, we were both oblivious enough, I think, that we weren't really freaking out or scared or really even all that worried. We just knew we just needed to roll her up to labor and delivery and get her signed in and get her into a room, and then everything would proceed as normal, and get her a bedside nurse and check her vitals and all those things. No problem. So we rolled off the sideways elevator into the main lobby because that's where it connected to. We rolled her off, and the main lobby was completely empty because by this time it was around midnight. There was no one there whatsoever. Not a security guard, not visitors, nobody, nothing, empty. And all of a sudden, she made a funny sound. The mom did. It wasn't even like screaming in agony or anything like that, just a funny sound. And we heard what sounded like just a balloon popping. And I've been at so many deliveries since then, thousands and thousands, and I've never heard exactly that same sound, but the best we could figure is that was her rupture of membranes happened exactly as the baby was just being precipitously delivered right onto that stretcher. And we had nothing. We didn't have a bulb syringe to suction out his mouth or nose. We didn't have a warming blanket, a towel, a resuscitation table, oxygen suction, nothing. We didn't even have gloves. Now, it would be asked of us later if we had taken with us a Stat Vag delivery pack. And that seemed like that would have been a really good idea. But we had no idea when we got a consult for abdominal pain that she was full-term actively in labor. Anyway, so we were very surprised. We didn't have much we could do. She had a sheet, one sheet on this stretcher, so we did use the sheet to sort of stimulate and dry the baby. We did not cut the cord. We had nothing to cut it with, and so we just sort of placed the baby between her legs and found the nearest elevator in the lobby, and we pushed her towards the elevator, got the doors open, and realized her stretcher won't fit in the elevator that's in the lobby. The lobby elevator was just for visitors. It wasn't for patients. There is a patient elevator off the lobby. So we went to that door and it was locked. Well, that's a problem. We've got a newborn, thank the good Lord, who is crying and breathing and not blue or in distress, because at that point, I wouldn't have been a whole lot of help with the neonatal resuscitation protocol. Since then, I used it a million times, but not at that point. I was just a second-year medical student. The mom was just a little bit out of it. The baby seemed okay, thank goodness. Color was good, was not blue. We were good. But you know, babies can suffer from loss of body heat very quickly. They're very sensitive to the temperature. They don't have the strength to maintain their own body temperature. So this is a problem. And we did put the little sheet around them as best we could. Mom's just wide open, knees apart on the stretcher. And not really complaining, which we were very grateful for. And we were just a little bit, now we're freaking out. We weren't before, but now we were. Okay, we have got to get this mom to labor and delivery. And we got to cut the cord and we got to get the baby evaluated and come on now. And so my resident called security. There was some sort of an emergency phone and we used it to call campus security or hospital security. Please come unlock the door to the patient elevator from the main lobby in Duke North. Now, we need it now. Did I mention that my resident was really passive? So what that conversation sounded like was more like, I'm sorry to bother you. We need for you to come unlock a door for us in the lobby of the hospital. And guess what? I guess security was really busy. They had better things to do, right? And so nothing happened, nothing happened, nothing happened, nothing happened. And finally she assigned me, the second-year medical student, to call 911. And I know that sounds ridiculous, and it kind of was, but I did. I dialed a 9 to get out of the hospital, dialed 911, got an operator, and I said, ma'am, I know this seems crazy, but we have literally just delivered a baby here in the lobby. We cannot get the mom with the baby between her knees into the patient elevator on her stretcher. The door is locked to the tower with the patient elevator in it. You have got to get us help. And so that 911 operator contacted hospital security, and within minutes they arrived and unlocked the back elevator. So we pushed her onto the patient elevator where the stretcher actually fit. And then it was hilarious because there was a maintenance guy or something in the elevator and his eyes just got really big because we got a mama just lying on the stretcher, blood everywhere, knees apart, baby just sitting there, thank goodness, okay. And so we got her up to labor and delivery, got her checked in, got the cord cut, got the baby warmed and evaluated. And I wouldn't have told you this story except except that everything absolutely turned out fine. And I'm quite certain that had never happened before, and certainly not since. But when would you be in one of the nicest hospitals in a university setting in the whole country and have to dial 911 to get your patient upstairs? It was insane. But I will never forget it. And that was my very first delivery. And of course, went on to so many more. But boy, I started it off with a bang, literally.